here I'm going to talk about the types of wound. Wounds can be caused in a number of different ways by a variety of different objects, be it by blunt, sharp, or projectile, and they are classified into several categories dependent on the cause and resulting injury. We have here a picture of the normal skin. There is an incision wound, laceration wound, abrasion, puncture wound, penetration wound, contusion, and hematoma. So you can see here for the normal skin, the epidermis and the dermis is intact. So with an incision wound, a clean or a straight cut caused by a sharp edge. Now for the laceration wound, it's a messy looking wound caused by a tearing or crushing force. Doesn't tend to bleed as much as incised wound, but often causes more damage to surrounding tissues. So an abrasion, a wound caused by a scraping force or a friction, tends not to be very deep but can often contain many foreign bodies such as dirt after a fall on a loose ground, for example. So puncture wound. A puncture wound is a deep wound caused by a sharp stabbing object, for example, a nail, may appear small from the outside but may damage deep tissues, particularly dangerous on the chest, abdomen, or head, or major organs. Now, penetration wounds are caused by objects that penetrate the body, that is, they pierce the skin and lacerate, disrupt, destroy, or contuse adjacent tissues, thus creating an open wound. A contusion is the medical term for a bruise. It is the result of a direct blow or an impact, such as a fall. Contusions are common sport injuries, so most people think of a bruise as a black and blue spot. A hematoma is a bad bruise. It happens when an injury causes the blood to collect and pool under the skin. The pooling blood gives the skin a spongy, rubbery, lumpy feel.
So let's get started. So the acronym that we use to do our incision and wound assessment is RETA. RETA stands for redness, edema, ecchymosis, drainage, and approximation. And I'm going to go through each of those in detail. So first up is redness. It is as simple as it sounds. You're going to assess the wound and incision site for any redness. As you can see here, there's some redness around these sutures, and here there's a lot of redness there too. That could indicate inflammation, it may be painful, so you want to make sure that you document redness. Next is edema. Edema is swelling, so if there is swelling around the wound or incision site, that is something you want to note as well. You can see here that you can see the indent and the difference, and here you can also see the difference. Next is ecchymosis. Ecchymosis, in its basic form, is basically just bruising. And this picture is really good because all of this dark discoloration of the skin would all be considered ecchymosis. Next is drainage, but we can classify drainage in 4 different ways. We can have serous drainage, that is just clear, watery liquid. We can have sanguineous drainage, that is bright red blood. We can take serous and sanguineous and combine them and get serosanguineous drainage, which is exactly the two combined. It's kind of a mixture of clear, watery, and blood, so it's kind of a pink substance. And lastly, purulent. That is our thick, green, yellow pus discharge. Here. You can see that this picture that I just drew on has a little bit of both. Up here is very well approximated, but down here, that's not well approximated. We also have some helpers that we can use to help approximate the wound. These guys over here, Steri-Strip.
To describe the wound drainage, we use the acronym COCA: color, odor, consistency, and appearance. We have prepared a video on how to change a wound dressing. Before doing any procedures, introduce yourself to the patient. Position the patient comfortably. The supplies that we will need is a dressing tray, a MIPOR bandage, appropriate for the size of the wound, sterile Q-tips, measuring device, saline flush or saline solution, and then sterile gloves if you're doing a sterile technique, or clean gloves if you're doing a clean technique. Perform hand hygiene. Prepare your sterile field. Preparing the dressing tray, make sure you practice the sterile principles. Remove the things that you don't need in the sterile tray and put them in the sterile field. Leave the gauzes in the tray and make sure you leave one compartment for you to prepare the saline solution. Measure the wound using a sterile Q-tips and a measuring device. Measure in the widest diameter of the wound across. And then you can also measure the depth using this technique. And then measure it on the measuring device. Take this chance to assess the wound using what we've learned earlier, the acronym RIDA and COCA. Apply a MIPOR dressing over the clean wound. For best practice, label your dressing beforehand. Next is document your assessment. Do not forget to include RIDA and COCA, what kind of bandages you used, and how well the patient tolerated the procedure.
Wound care management. Guidelines for wound management. Promote a multidisciplinary approach to care. Initial patient and wound assessment is important and whenever there is a change in condition. Consider also the psychological implications of a wound, especially relevant in the pediatric setting, in relation to developmental understanding and pain associated with the wound and dressing changes. Determine the goal of care and expected outcomes. Respect the fragile wound environment. Maintain bacterial balance. Use aseptic technique when performing wound procedures. Maintain a moist wound environment. Maintain a stable wound temperature. Avoid cold solutions or wound exposures. Maintain an acidic or neutral pH. Allow a heavily draining wound to drain freely. Eliminate dead space, but don't pack a wound tightly. Select appropriate dressings and techniques based on assessment and scientific evidence. Instigate appropriate adjunctive wound therapies. like examples, compressions, splinting, and pressure. Redistribution equipment and offloading orthotics.